Hello, my name is Marie Haycock, and I'm going to be discussing rural health grant opportunities in my community. What is a grant? A grant is a way that the government contributes to funding for projects and ideas to public services to help stimulate the economy in order to benefit the general public. Grants are awarded in the form of innovative research, infrastructure building, and recovery initiatives. Grants can be received by state and local governments, universities, researchers, law enforcement, and organizations that are planning projects to benefit the population and community. Government grants are also offered to those in need to help lower expenses. The importance of grants. Funding means investment in healthcare infrastructure. Many rural facilities were built in the 1940s and 50s, so infrastructure is a major capital project to renovate or rebuild. Efficiency, size, and quality of equipment in the facility is directly related to the healthcare facility's ability to meet the needs of a rural patient community. To maintain financial viability, a facility must stay up to date with equipment, retain healthcare staff, improve patient safety, and expand services to make capital investments. Another funding need in recent years was the move to electronic health records and the installation of telehealth. Funding can come from multiple sources, such as foundations, local donors, public grants, and low-interest loan programs. The Community Foundation of Dickinson County is a grant-making public charity dedicated to improving the lives of people in Dickinson County. The mission is to encourage philanthropy for the benefit of the community. The foundation has been helping donors put charitable dollars to work addressing concerns most important to them since 1999. And the foundation has allocated more than $2.8 million in grants since 1999. Some grants that were given by the Community Foundation include Brown Foundation Browns Park. They spent $1,000 in a new playground equipment. The Great Plains Theater gave to the Children's Youth Theater and Technology Update. That also contributed to the fire that destroyed the theater in 2014. The Abilene Food and Clothing received a grant to support the community. The school district purchased heart rate monitors for physical education. And the Quality of Life Coalition received a grant for the Happy Bear program in Dickinson County. The Boy Scouts of America received $250 to support the local Boy Scouts. The grants are awarded in the fall and spring cycles. The fall deadline is October 26, and then announcements are made December 13. Some priorities given over grants include projects that develop or test new solutions to community problems, address prevention as well as remediation, projects that provide assistance to underserved community resources, projects that build organizational capacity and improve the effectiveness or efficiency of nonprofit groups, and projects that community involvement prefer to economic development. I decided to look at the community of Abilene's opportunities for grants. The community of Abilene is about 7,000 people, and the hospital called Abilene Memorial Health System is a 25-bed critical access hospital serving Dickinson County since 1922. The Memorial Health System affiliates with a clinic, a nursing home, a home health care, a daycare, a retirement home, a fitness center, and a pain clinic. A grant that I found when researching was the Small Hospital Improvement Program. It is a grant for small rural hospitals' activities for quality improvement in health information technology. SHIP is managed by the State Office of Rural Health at the Kansas Department of Health and Environment. It is supported by the U.S. Department of Health and Human Services and assists hospitals in meeting the required data implementing systems as required by Medicare. It is funded by the Federal Office of Rural Health Policy and the Health Resources and Services Administration. Qualifications for this grant include the facility must be 49 beds or less as filed on the Medicare cost report. It must be in a rural area outside a metropolitan area, a non-federal, and a short-term acute care facility. The SHIP grant is a full-year grant cycle. Between $8,000 and $9,000 can be awarded directly to the hospital for the goal of accurate billing and coding, improving data collection, improve quality outcomes such as reducing medical errors, education and training and data collection and reporting, and improving care transitions and accountability between ambulatory, acute, and step-down facilities. There are 3 areas that the organization can use this grant: value-based purchasing, activities that support improved data collection to facilitate quality reporting and improvement, such as HCAHPS data collection, provider-based quality measures training, efficiency or quality improvement training, and project and support of VBP related initiatives. The next area is accountable care organization. These are activities that support the development or basic tenets of ACOs or shared savings programs. These include computerized provider order entry, pharmacy service implementation, mobile health equipment installation and use, systems performance training, community paramedicine training, health information technology training for value and ACOs. The last area is payment bundling, which is to improve hospital financial processes, such as ICD-10 software and training and pricing transparency training. The Sunderland Foundation is a grant that provides annually for building construction, renovations, and repairs for facilities. Health facilities, higher education, youth service agencies, community buildings, museums, arts and culture are given priority. The foundation prefers to make grants for special projects. It is one of the largest foundations in Kansas and is only awarded to 9 states. In 2016, the Eisenhower Museum Center in Abilene was awarded $3.6 million for art and culture projects. The Abilene Memorial Health System added on and renovated their facility in 2013. However, I was unable to find information if they used this grant. The Kansas State Loan Repayment Program is a grant for healthcare providers to receive assistance with repayment and student loans with the agreement to a minimum 2-year commitment at the designated health professional shortage area. It is funded by the State of Kansas and Health Resources and Services Administration, along with the National Health Service Corps. They must be employed by a nonprofit organization. Applications are open from June 1 to July 31 of each year. The 2-year period begins October 1 and ending September 30. Physicians and dentists must agree to a 2-year commitment and receive up to $25,000, and all other providers will receive $20,000 per year of service commitment. After the initial obligation, providers may renew their agreements in a 1-year increment up to 3 years of loan repayment. The awards are made annually, and applicants are selected with a review process based on community need, practice site information, and provider personal statement. The practice site must have a written non-discrimination policy and provide services to those regardless of insurance type or ability to pay in order to meet the needs of the general population. Here is a graph that shows the current state loan repayment awards by discipline. And as you can see, the nurse practitioner and physician assistants discipline is the largest that receive this grant. Another grant that I researched was the Charles A. Freoff Foundation. It offers grants for communities in the areas of education, human services, and health-related causes. This foundation is committed to helping those who work at the front lines of healthcare to address the needs of communities. It is available in 27 states and offers 10,000 or less. The goal is improving access and raising the quality of healthcare for a population. Hospitals can receive grants for equipment, outreach programs, staff positions, screening, and educational materials. Here are my references, and I hope you enjoyed my presentation on rural health grants.